Good afternoon and welcome to Waco City Hall for our weekly press conference on COVID-19. I'm Larry Holsey, Director of Municipal Information and Communications for the City of Waco. I'll be the moderator for this, and in a moment I'll introduce all of our panelists, but we're observing social distancing. We have Julie and Aubrey here from the City Secretary's office in this room with me. We all have our masks on, respecting what we think definitely and know makes a difference in protecting yourselves and those around you from the COVID-19. Downstairs in our studio on the first floor, we do have an American Sign Language interpreter doing that insert that you see in your bottom right-hand corner to make sure those persons in our community who are not able to hear like we like to be able to get this information. And likewise, in our studio, we have a Spanish interpretation being recorded audio-wise, and we'll be laying that over the video later on today. And at 4:30, we'll be airing that on our channel here for all the Spanish speakers. And always so great to be here to help introduce and invite our Spanish speakers to come back at 4:30 this afternoon is our Mayor Pro Tem, Hector Sabito. And Hector, you also, if you'll take the opportunity to please talk about the opportunity that you as a co-chairperson of the Strategic Communication Group, about the opportunity tomorrow night that we'll be airing on our channel as well. So Hector, will you take it away, please?
Absolutely, Larry. Thank you so much, as always, for the invitation. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. También quiero tomar esta oportunidad para invitarlos a todos los que hablan español a un ayuntamiento virtual la próxima semana, el jueves 28 de enero a las 6 de la tarde. Vamos a tener una junta para hablar cómo la vacuna le puede ayudar aquí a la comunidad de Waco. También va a estar con nosotros esa noche, va a ser la doctora Ileana Newman de Family Health Center, el doctor Horacio Sosa de Family Health Center, la directora Isabel Lozano, la directora de la escuela Kendrick Elementary, y el pastor Tomás Gutiérrez de Viento Fuerte Church. Así que les quiero invitar para mañana, la próxima semana lo pueden ver en wccc.tv o también en la página de Facebook de la ciudad de Waco. Larry, thank you so much. And I would like to take this opportunity to invite all of our listeners today to a virtual town hall that we're hosting, our Strategic Communication Group, tomorrow, the 21st, on Thursday evening at 7 o'clock. Guest panelists would include Commissioner Pat Miller, Council Member Andrea Bearfield, Dr. Terry Woods Campbell, Dr. Peaches Henry of the NAACP, among others. And they're going to discuss the safety and the need for the COVID-19 vaccine that is coming into our county now. And so people can find that virtual meeting on our cable channel, WCCC.tv, or on the City of Waco's Facebook page. Thank you so much again for the opportunity to be here.
Thank you, Hector, and thanks for helping host that, along with Natalie Kalinsky, who is your co-chair of that Strategic Communication. Joining us today on our panel, I'd like to introduce is our Waco Mayor Dylan Meek, McLennan County Judge Scott Felton, Dr. Jackson Griggs, CEO of Family Health Center, Dr. Richard Haskett with Ascension Providence, and Dr. Umad Ahmad, Interim Chief Medical Officer for Baylor Scott and White Hillcrest. Thank you, gentlemen, for again coming back and providing information. What we'll do is we'll let each one of you make a statement, and then we do have two media representatives on the phone on our Zoom meeting that we will open the mic for and let each one of them have probably two questions each, and then our mayor will wrap things up. So we'll hopefully get this done in an hour, so everybody stay tuned and get ready to get us a lot of great information. So let's start off our opening panel information with our mayor, Mayor Dylan Meek.
Good afternoon. I appreciate everyone taking the time to join us this afternoon, and thanks for those panelists joining us on the call today. I'll talk briefly about hospitalizations and then move on to vaccinations. Thank you to the healthcare providers in our community. You are extravagantly serving us, and we are very thankful for you. Our local hospital systems, our city staff, our county judge, and myself are in close, regular contact with one another as we discuss and monitor data regarding our hospital capacity and hospital personnel, and monitor whether or not there will be a need for an alternative care site. To date, this seems more improbable than probable. Our hospitals and our Waco-McLennan County Office of Emergency Management have developed robust plans to keep our populations safe should the hospital patients increase to a degree of serious harm. Our local doctors continue to advise us of the seriousness of this virus, and I urge our community to make wise decisions in the days ahead by following our local doctors' calls to wear masks in public, follow safe distancing protocols, and wash hands. Following this doctor-endorsed protocol makes this situation not as fearful. As a reminder, at the present time, Texas mayors and local governments have almost no policy-making authority. Governor Abbott has implemented and has control of the regulations and mandates, from wearing masks to closures of bars and occupancy requirements of businesses. The governor has issued orders stating that we cannot issue more restrictive orders than him. We have not heard any word from the governor's office that this might change at this time. The Waco-McLennan County Office of Emergency Management is working with the Texas Department of Emergency Management and our docs health testing to provide free COVID-19 testing to the community. When you register online, it does ask you for your insurance information. You do not have to have insurance to receive a test, and people with insurance will not have to pay any out-of-pocket cost or copay to get the test. Please go to covidwaco.com to register. The Waco-McLennan County Emergency Management Office previously received a refrigerated truck that is being used as a temporary morgue. The refrigerated truck is currently housing 23 remains. I will give a brief update on our health district's role in providing vaccinations to our public, and then Judge Felton will discuss more broadly vaccinations happening at the state and with other vaccine providers in our county. Now, as a reminder, the health district is but one of 20 vaccine providers in McLennan County. So HEB, the VA, CVS, our hospital systems are all vaccine providers, and the health district is one of those. In fact, our public health district and Providence are both serving separately as hubs here in McLennan County, designated as hubs by the state. And the health district is committed to serving our public well and to being completely transparent with all of the data. And with that, I'll move into this report. Today's day one of the second vaccine clinic. We are running the clinic today and tomorrow and distributing the second 1,500 dose allocation that we recently received from the Texas Department of Health State Services. We have heard the many frustrations with the clinic registration process. And I want you to know that we are listening to you and that we are continually looking at ways that we can make this process better and ensure that it is as equitable as possible. I would ask for your patience for our health district and the city staff. They have worked tirelessly through this pandemic and now through this vaccine distribution process. This is just the second allotment that we have gotten as a function of being one of the state's 28 vaccine hubs that I just mentioned. And we've made a number of changes to the registration process over the past week. Some of the things we did differently in our registration process were to announce 24 hours ahead of time that appointments would be made available, to open up the registration at 2 different times to provide accessibility for those who may be working on weekends, and to reserve a percentage of appointments specifically for people who are calling because they might not have online access. Throughout this process, we have communicated and worked with area churches, nonprofits, and social service agencies and community leaders to try to ensure that our most vulnerable populations are not being left out of this process. And I want to thank those organizations for their help. In the first clinic, about 87% of the appointments were made by McLennan County residents. Just over 7% of individuals vaccinated were African American and just under 9% were Hispanic. 88% of the individuals vaccinated were white. This week, 77% of appointments were made by McLennan County residents. Again, about 7% are African American and just under 14% are Hispanic, 86% are white. We are committed to evaluating our process, as I mentioned, and making adjustments to ensure that this is an equitable process and that everyone will have fair and an equitable opportunity to get this vaccine through our public health district. Ultimately, the 1,500 doses allotted to the public health district that we're getting is nowhere near enough to meet the demand we are seeing it within our community. This week, online registration were full in less than 10 minutes on Sunday and in less than 5 minutes on Monday. In just over a 36-hour period from Sunday to Monday, our call center received almost 20,000 calls. We had 8 call center operators on Sunday and 12 on Monday. These staff were able to answer and speak with 571 callers in less than an hour on Sunday and 491 callers on Monday. For future clinics, there will not be a registration period like what we have hosted in the past 2 weekends. The health district has established a wait list for the vaccine. If you have already attempted to sign up for appointments and either signed up for the wait list through the registration portal, text number, or through the email newsletter, you will be on the wait list. We have almost 14,000 people on the wait list, and that continues to grow. Beginning today, a waitlist registration link is available on covidwaco.com or by calling the call center at 254-750-1890 for assistance registering. The health district will contact people from this list to fill cancellations and schedule appointments for future clinics. All vaccinations continue to be by appointment only. There are no walk-ups accepted at the vaccine clinic. We are excited to continue this vaccination effort in Waco and McLennan County, and I would like to personally thank our Waco-McLennan County Public Health District staff and supporting City of Waco departments and all the community partners who have made these clinics function as they have to date. And thank you for the efforts that you have made. You're doing important work in our community. So with that, I will now turn this over to Judge Felton for further comments.
Good afternoon. Thank you, Mayor. As mentioned, there's 1,500 doses that are out this week to be injected into the arms of our citizens. Although 1,500 doses are in our allocation may seem like a large amount, it's only a small percentage of what is needed in McLennan County. And as a hub designated by the state, the Waco-McLennan County Public Health District is providing access to vaccines to not only our county, but in our region and to the state. I'd like to remind our community that the health district and the vaccines clinics that we're hosting are just one of the 20, as many as 20 providers in McLennan County, as the mayor mentioned earlier. We learned recently that the vaccine has not been held back in the federal stockpile, as we're told. As soon as the vaccine is ready, it is immediately shipped out to the state, who allocates it further to the providers. According to the Texas Department of State and Health Services, Texas has vaccinated 1.3 million people, which is, by the way, the most of any state. In McLennan County, 8,786 people have received their first dose of vaccine, and 1,003 people have received both vaccines. In other words, they're fully vaccinated. Vaccine has been sent to a variety of providers, including pharmacies, primary care clinics, specialty clinics, and urgent care clinics. You can find a map of all the providers in Texas with their contact information on the covidwaco.com website and the DSHS website as well. Unfortunately, because of the lack of vaccine availability, we are hearing that we won't be able to expect an increase to our 1,500 dose allocation anytime soon. We continue to advocate with the state of the need we have for our vaccine in our community, and we are telling them that our staff is capable of getting these vaccines out very efficiently. I want to also say that our local, state, and representatives, both our state representative Doc Anderson and Senator Birdwell have both been very engaged, as well as State Representative Kyle Cassell. Also, several of us on the city and county level have been staying in contact with Austin with the Texas Department of Emergency Management that reports directly to the governor. As we continue to host these clinics, we will see more and more people who need the second dose, therefore putting more pressure on the amount of vaccine inventory that we have. If you've received your first dose from Waco McLennan County Health District, you will be contacted with a reminder to schedule your second dose. You do not have to get your second dose at the same location you received the first dose, but it must be at the same brand. In other words, if you start with Moderna vaccine, your second shot should be Moderna, and same with the Pfizer. You should get your second dose as close to the recommended follow-up date as possible. However, even if you are deemed past the date, you should still get your second dose. But with the Pfizer, it's 21 days after the first shot that it would be time to get the second injection, and with Moderna, it's 28 days. It's recommended that you don't get the second dose prior to those days. I'd like to say thank you to our community for your interest and for your care as we continue to navigate this pandemic together. Even as vaccines become more available within our community, we still have a long road to go. So let's keep protecting each other by wearing masks, avoiding crowds and gatherings, and washing your hands. Thank you, sir.
Okay, let's go to Dr. Jackson Griggs, the CEO of Family Health Center, with some information. Dr. Griggs?
Yes, thank you, Larry, and thank you, Judge Felton, Mayor Meek. This pandemic has brought wave upon wave of complex challenges, and consistently, city, county leadership, hospital leadership has been there to meet the needs. So I have ongoing gratitude. I'm going to jump into the numbers of McLennan County. But before I mention McLennan County, I think it's worth just acknowledging as a country that we've crossed that marker of 400,000 deaths. And on a week-to-week rate right now, COVID-19 is the #1 killer in the United States. I think that's a sobering recognition for all of us of where we are in the pandemic, and maybe for any individuals in the community who have been reluctant to really believe the dire necessity to implement behavior change, maybe that figure will be the impetus to help make some change there. In our county, the total number of confirmed cases to date is 22,373. 1,087 of those cases are currently active. As of this afternoon, the Public Health District has received notification of 81 new cases of coronavirus. 139 people are hospitalized at present with COVID-19, and 25 of those presently hospitalized are receiving ventilator support. We have 7 additional deaths to report, and we have now seen a total of 337 deaths among our neighbors and community members in McLennan County. Within nursing homes in the county, currently there are 14 current facility outbreaks. There are 29 active cases among patients and staff in these facilities, and there have been a total of 121 nursing home associated COVID-19 fatalities to date. There are no current church clusters identified within McLennan County. There are 14 independent school districts and 4 private schools that are reporting cases. There are a total of 60 individual school campuses with active cases. And within schools, there are 178 active cases, 115 of those are students, and 63 are staff. Before I transition to some slides, I'd like to share with you, and I think Julie's going to run the slide set, but before I make that transition, I just want to give you a brief update on the vaccine efforts at the Family Health Center. So community health centers like Family Health Center across Texas were slow to get vaccines from the state. We received some 200 vaccines in individual doses in the first 4 weeks. And at present, Family Health Center has administered 599 vaccines, and we're grateful to Ascension Providence for sharing 150 doses, and that's included in that 599 that have been administered. That helped us to finish vaccinating our employees that take care of patients. And I have good news to report this week that Family Health Center has received 800 additional doses from the state. So we are going to, we're actually right now really hustling, trying to contact all of our patients who are at the highest risk of hospitalization and death in order to call them in to get them vaccinated. We anticipate that we will have all of those 800 doses in arms by the end of the week. And we are hoping that the state continues to send community health centers like ours additional doses. Now, Julie, would you mind transitioning to the slides? So just as before, I'm showing new cases per day per 100,000 in population so that we can compare United States, Texas, and McLennan County. This is again on a 7-day rolling average to level out peaks and troughs. And what you see here may be the beginning of some good news. I'm reluctant to overstate good news given how much is at stake. And it's important to note that we're still very much in that red zone of accelerated or of being in that tipping point zone such that at any moment we could turn around and see exponential spread again. But at least it looks like for the last week or maybe 10 days, we have seen a decrease in the 7-day rolling average of new cases per day. We are now quite a bit less in terms of new cases than the United States, which is at 71 new cases per day per 100,000, and below Texas, which is at 77 new cases per day per 100,000. Next slide. And next slide, Julie. Thanks. This just emphasizes that point where you do see that that decrease in our average, but we're still in that red zone. So not a time to relax, not a time to back off on masking and avoiding crowds and social distancing, but maybe the beginning of a reprieve from the kinds of cases that we've seen. Next slide. In terms of positivity rate, we're still quite high at 19% positivity rate, almost twice the threshold for mitigation. So as I've stated before, it's just so important that anyone with even minor symptoms get tested. And of course, if you believe you may have had contact with someone who was diagnosed with COVID-19, please get a test. Next slide. Here you see the COVID-19 positive patients admitted to our 2 hospitals in our community. And again, I'll of course defer to the chief medical officers who are on this press conference, but to speak to specifics, but maybe there's a little bit of leveling off, obviously still at an extraordinarily high rate of hospitalization, but perhaps that leveling off is the beginning of a positive sign. Next slide. The death rate continues to be very high. As you'll recall, we had our highest rate of death in December with 84 of our community members dying. In January to date, we have had 50 fatalities. And then final slide. This just shows in gray the incidence or new cases per 100,000, and then a line graph superimposed that shows our positivity rate. And you can see that back in June and July, we had high numbers of incidents and high positivity rate. And as our positivity rate came down, so did our incidents. And then you saw our incidents really grow in November and then leveled off some late November and has stayed very high with a jump around Christmas time in the new year and perhaps again the beginning of a decrease in new cases. But our positivity rate is still very, very high. So to reinforce the point, test even with minor symptoms or any suspected contact with COVID-19. And then even though we're hearing about vaccines, it's way premature to begin to assume that we have enough vaccines in the community to relax in terms of masking. So to really make it very clear right now, it's critical that we all continue to mask anytime we're not with our household members. Avoiding crowds and clusters of individuals is still critical. Use outdoor air to your advantage. So open a window if you happen to be in a space where there's an indoor space with a non-household member. I know it's cold, but maybe wear a jacket or use a blanket. And if you really need to meet with someone, try to meet outdoors. Continue good hand hygiene, and of course get vaccinated just as soon as possible. My vaccine was on the 8th of January and had, other than a little fatigue afterwards, had a little night sweats that first night, otherwise did just fine. And I'd encourage everyone to get the vaccine just as soon as possible. That's all I have in my report.
Thank you, Dr. Griggs. Let's go to Dr. Ahmad, Interim Medical Director for Baylor Scott and White Hillcrest. Dr. Ahmad?
Thank you, Larry. And thank you, Mayor Meek and Judge Felton. Our capacity-wise, our hospital, as Dr. Briggs was mentioning, the numbers have started trending in the right direction, and that's hopefully is a trend. But before we get excited, I want to just have a glimmer of hope that these numbers are a sign that we are getting into the right direction. We are still 100%, but our COVID numbers are going down. We have been able to vaccinate our 1A or our frontline providers, caregivers, and along with the healthcare providers. And now we are shifting our energy in trying to find a methodology and process in place to vaccinate our high-risk population in the community, which is considered 1B. You already heard from Mayor, we have two hubs. One is Providence and one is our health department. And we are working with both of them to get the vaccines and vaccinate together as a team for this community. One of the interesting aspect of this pandemic which brought us together is that all the healthcare system has started understanding how our focus has always been patient, and it has just brought us together to make sure that we can serve our communities by joining hands. And I've been very appreciative of our partners in the community and our leadership in the city, especially Mayor. We have no challenges in the ventilators in our PPE supply. We have still held our elective surgeries. We do not anticipate to open through this month. we have been able to accommodate any kind of challenges for McLennan County, and we feel, as Mayor was mentioning, it's improbable that we will be opening an alternate care site. And we hope that we are going in the right direction. Just to highlight a little bit about the vaccine, I also, like Dr. Briggs, got the vaccine safe. And to get a herd immunity, 70% of our population needs to get vaccinated. In prospective for state of Texas, there are approximately 29 million. Of that, 25% is below 18, though Pfizer is still approved from 16 to 18 years of age. But assuming that 75% of the population is above 18, we at least need 15 plus million to get vaccinated, and we are only at 1.3. So as my colleagues are mentioning, we are going in the right direction, but we are way behind in where we want to be, and we are hoping we'll get there. Please, while even if you get vaccinated, do not stop social distancing. Continue wearing the mask and continue hand hygiene through the rest of the time till the state itself or governor allows that something is major changing, because your family could still be the carrier. Last but not the least, I do want to applaud our frontline healthcare providers, and I appreciate for the sacrifices they have made for a year. I think, if I'm not wrong, it's been a year this month that we had our first case in the United States. So thank you for all the hard work and the sacrifices, and that's all from me.
Thank you, Dr. Ahmad. Now let's go to Dr. Richard Haskett with Ascension Providence. Dr. Haskett?
Good afternoon, Larry, and of course I would like to thank my fellow panelists, and I'm glad to be here representing Providence in this news conference. Touch on a couple of things. First, let's start with our hospital. We continue to be at or above 100% capacity, as we have been for the last several weeks. But we too have seen a very small decline in the volumes that we are seeing. We are at 77 COVID patients today. We have run as high as the mid-90s as of a few weeks ago. So I would hate to say that I know that we're getting better permanently, and that's a permanent trend, but I think I have enthusiasm and hope that we're potentially turning the corner, and with great focus, we'll continue to do so. We are continuing to use nurses to help with our care from the FEMA and the STAR programs, as well as several traveler nurses. We do have adequate PPE, we do have adequate ventilatory capacity, and though tired, our morale and the morale of our people remain strong and steadfast. We've just seen no decrease in this, in that aspect of this for our people, and we do not expect that we will. We continue to be unable to perform elective surgeries, and we have had that status since December the 2nd. So I do not have line of sight into when that will change. And we would echo the comments about the alternative care side that the other medical officers have given. Now, moving to vaccines, just to touch briefly on vaccines, we were grateful to be one of the hubs. We were grateful on behalf of this community, because we have thousands of people to vaccinate just to get through 1A and 1B. And we have about 200,000 people to vaccinate in this county to get to herd immunity. So every dose that goes in an arm is a dose that gets us that much closer to getting our world and our life back in McLennan County and in this state and in this nation. And we're grateful for the opportunity to do that. We have had some challenges as we are managing the very large volumes of COVID that are inpatient, the extremely large volumes of patients that we're managing on the outpatient setting, our entire clinic system, and then to learn how to vaccinate has been a challenge. To date, we have gotten 1,066 people dosed with both doses, and we have given 2,648 first doses to the people of this county. So not where we need to be, but a good first step. We have had laser focus on the 1A population, have slowly moved into 1B, primarily focused on partnerships with FHC that Dr. Griggs spoke to a few minutes ago. We are working in a collaborative fashion with the Baylor Scott and White system as well. And we will continue to be focused on that collaborative effort, and of course, along with the county. Our one struggle that we're working through is having a public facing component of this. And so the state has mandated that every dose that you get, you need to get in an arm within a week. We focused on that, but we are moving to have a better ability to serve from a public capacity and hope to have that up soon.
Thank you, Dr. Haskett. And before we go to the media, we're going to go back to Judge Felton. I think he had wanted to say something about the jail. Judge, are you okay to go ahead with that?
Yes, sir. Be glad to. As you know, and as the paper reported, we did have an outbreak at the jail. We had, as of this morning, we had 30 inmates that tested positive, as well as 7 staff members. We have 283 inmates in quarantine right now. The jail is in what we call a shutdown mode. And so the attorneys and the judges are using the jail on a limited basis, which might mean that plea bargains where someone's out on bail that in the plea, it could mean that they get some time in our local jail, then that would be postponed until a later time. Right now we have 1,255 inmates in the jail, and we still have adequate room to be able to quarantine a segment. The general protocol at the jail is when in intake, there's an area that new folks that are introduced into the jail are held for a certain amount of time until they've had a certain amount of days and positive tests before they go into the general population. And so I think we, as in the past, we've been able to manage through these things so it didn't, the virus didn't run all the way through the jail. We had it at a limited amount. And that's our program right now. The other thing that I might mention that also has been reported that the Texas Supreme Court Chief Justice Nathan Heck has postponed any kind of jury trials until April. There are certain types of judicial proceedings that can take place, such as plea bargains and things like that. But as far as getting trials together, calling in citizens to impanel a jury is postponed. We look forward to working with the Public Health District and others to really refine a time when and the protocols around calling jury trials again. And we want when we do that, we definitely want our citizens to be confident that they can come and serve the public and still be very safe in doing that. So we've got some time before that happens, but we're very cognizant of it. And we've done a lot of things also within the county to protect our employees as well as people that come to the county to do business. And I'll be glad later if any of the news people have any questions about that to expand on my comments.
Thank you, Judge. Let's now go to the media part of this press conference. We have 2 media representatives who are registered today by the deadline. We have Rihanna Saget with the Waco Tribune Herald, and we have Abby Loring with KXXV Channel 25, and we'll go in that order. We'll make 2 rounds. Each person gets to ask 1 question. Let's start with Rihanna Saget. Rihanna, you on the line?
Yes, hello. I had a question about this overall decrease in cases and hospitalizations and why we think that might be. Is this coming back down from infections over the holidays or possibly some other factor?
Dr. Griggs, do you want to lead out on some your thoughts there? And then if Dr. Haskett or Dr. Ahmad wanted to add to it, then feel free to do so.
I think my first my first caution is, again, with, and I mentioned this last week, with high positivity rates, there's a large margin of error of actual circulating virus. There was a serology study that came out even this past week that suggested that there's something like 4 times the number of actual cases in the country than what's been measured through viral studies when sampling a population. And so with a high positivity rate, it's just very difficult to know exactly what's going on. So first, just take caution in interpreting the data. In terms of why we're seeing some decrease, it could be that there was less commerce that was occurring during the Christmas holidays through New Year's, and fewer people eating at restaurants, fewer transactions out in the community. That could account for it. It could be that individuals were just seeing the very high numbers and high hospitalizations and saw the alarm in the community and started modifying their behaviors to some degree. For whatever the reason, I'm just really glad to see the case counts coming down. I don't have there wasn't an exact phenomenon that I can say fully accounts for the decrease in cases, though.
I think it would be pure speculation on my part. I have some caution, just like Dr. Griggs does. I'm just grateful to the people of Central Texas that I think we're getting better at this. And I think that has something to do with it. And frankly, just grateful to God that maybe we see some hope.
Amen.
Dr. Ahmad, would you like to comment? You're muted right now. There you go. Okay, Rihanna, we'll be back to you in a moment, but let's now go to Abby Loring with KX6V Channel 25. Abby, on the line?
Hello, this one's for Judge Felton. You pretty much answered my question earlier, but could you better explain what this 10-day lockdown means? It means that no one in or out. What does that look like?
Well, basically, that's it. It gives the staff and the medical staff that we do have medical staff at the jail. It's a full staff with the doctor and the nurses and all the equipment, or a good bit of the equipment they need to handle situations like this. And it just cuts down the amount of new people coming into the jail. There's increased testing around in the jail to be sure that we're detecting the positives as quick as possible. And being able to manage that. We also have areas in the jail that have what's called negative pressure pods, that where the folks that are positive and sick, that we can handle them in there without endangering the rest of the building. And so it's all ventilated separately, use HIPAA filters and those things, but that's primarily what it is. It's just limited activity of the in and out, which limits what we can do here in the courthouse in regards to special type judicial hearings like plea bargains and those things.
Okay, Abby.
That does not mean that they're not arresting people that are breaking the law out there either. So I would tell the community, don't be alarmed about this, but it is a little bit different operating procedure than we normally have.
Okay, Abby, thank you so much. Hang on, we'll be back to you in a moment. Rihanna, are you back? Have another question for us?
Yes, I had another question about vaccine rollout. Is there any state guidelines saying whether or not people who've already received one vaccine should be prioritized for their second, or would the vaccines remain for kind of first come, first serve, or whoever's on the waiting list? Has there been any guidance given?
Yeah, and I might have Kelly or Jackson speak to this if you want to, but right now, if you've been given your first dose of a 2-part vaccine, then you will be getting a second vaccine. We do have no indication that there won't be supply for that. We do have supply for that at this time, and that is what protocol will be, and we will continue to, if you've gotten your first dose of a 2-part vaccine, you will be given a second dose. Is there anything, Dr. Griggs or Kelly, that you'd want to add to that? Great.
That's absolutely correct. Thank you.
Great. Thanks.
Okay, thank you, Rihanna, for that. Let's go to Abby Loring. Abby, you have another question for us?
I'm going to be easy, but y'all answered all my questions.
Very good. That shows you were paying attention. Thank both of you for being a part of our press conference. And Mayor, that's we're going to wrap up now and let you have the final word, if you will. Go ahead.
Great. Again, just thank you to the panelists on this. We have a great community rooted in collaboration. In the last several months, we've worked so hard together. And so I do thank Family Health Center, Providence, in Hillcrest. I do thank the judge and the county as a whole. And I thank the city staff who are working so hard to care with real intentionality for our community. So to you, the viewer out there, I would really encourage you to utilize our wait list to help people that you know are in that 1B category that have not received the vaccine yet. Hold their hand, help them out, and get them on the wait list. And as we get the vaccines, we will be distributing them. As we get enough, whatever allotment we're going to get through that week. We're not going to waste a single shot. We're going to put them, give them to the people who are on that list. So I just encourage you to do that and help your fellow man do that. So thank you for everyone's time today. I so appreciate all of the people who are helping in this cause, and excited that we are talking about vaccines, because I do think there are brighter days ahead. So with that, we'll sign off, and thank you, Larry.
Okay, thank you. I appreciate all 5 of you all for being a part of our press conference. I want to remind everybody that at 4:30 this afternoon, we have the Spanish interpretation. And anybody that's at work or hasn't been able to hear this whole press conference, we'll re-air it again at 7 o'clock, or it's available on demand anytime you want to. I also want to remind you of the fact that tomorrow night there will be a virtual public meeting, as it may be, that'll be airing on our city cable channel right here as you're watching this, on our live stream as well, that will be hosted and facilitated by the Strategic Communication Committee that Mayor Deaver set up about a year ago now, almost now, and they'll be speaking specifically about the vaccine. Commissioner Pat Miller will be hosting that with a number of persons. And then again next week on January the 18th, we'll be having all Spanish. So pay attention to all that information. This is great stuff that we're wanting you to make sure you know everything that we know and share that with the community. Don't forget to get your flu shot. That's still out there. We want to make sure everybody's protected against that. And any questions you have about anything COVID related, covidwaco.com is still the best place. It's updated daily. And we hope that you'll turn to that direction. That's it from here, from the City Hall. We hope you've gained a lot of information. We'll do it again next week. Thank you for joining us, and we'll see you next week.